Hi everyone, this is Muzna from the American Stroke Foundation. Today we are going to talk about, okay, I don't know if it started. Okay, so I should start again. Hi again. This is Muzna from the American Stroke Foundation. I'm an occupational therapist. Today we are talking about caregiver support. This Facebook Live Q&A is part of the American Stroke Foundation's virtual Next Step program. And for more information on what we're talking about today or anything else that we've talked about in the past, please visit our website at americanstroke.org. There you'll find links to our Instagram pages, our Facebook, and our YouTube channel, and you'll also find our blog. We really want to make sure that we're providing information that is value added for you, so please give us feedback on what you would like to see and what you would like to talk about. So today we're talking about caregivers. Caregiver in the broadest sense, as we're talking about today, is anyone who spends a significant part of their day providing care for someone else, or this information is also relevant to someone who is receiving care themselves from a caregiver. The concepts are all the same. It's about how do you balance those roles, how do you navigate the changing balance and role dynamics, and how do you make sure that both parties are getting their needs met in the caregiving relationship, but also in their relationship outside of that caregiver role. So whether it's a spousal relationship, whether it's a child-parent relationship, or any other relationship, you know, having a stroke or a life-changing event kind of throws those things into a little bit of a, you know, it throws it off into off-kilter equilibrium. So we want to make sure that we have a space to talk about those things and share your comments. So please start sharing your questions and comments about your experience as a caregiver to someone after a stroke, or your experience as a stroke survivor with receiving assistance or care from a loved one or someone else. Share your experiences, let us know where you're from, so we can help build up this community. So, caregiving. The word I think that jumps out to me whenever I talk about caregivers, or, you know, this area of healthcare, is really the word burnout. And for the purpose of this discussion, I'm going to define burnout as any sense of being where the feeling of being restored does not happen. So for example, if one of your symptoms of burnout is feeling very, very tired, then getting more sleep doesn't fix that tired. So there's more than just sleep being the problem. So that's how I'm going to talk about burnout, as in you cannot get that cup filled back up, even though you're doing the things that intuitively should be filling that cup, whether it's tired, frustration, sadness, any of the symptoms that are related to you not feeling well as a result of having kind of yourself extended in different roles. That's how I'm going to define burnout. So I think a lot of us, definitely after COVID, can relate to that word. When your roles shift, when your habits shift, it impacts your health. And I think the pandemic kind of just put that into focus for a lot of people, that a lot of us identify who we are and what we do and plan and manage our day around our jobs, right? And when that changed because of the pandemic, it threw everything into disarray. Suddenly we didn't realize that the things we used to do on our commute were very helpful for decompressing or getting warmed up to go to work. We were with our loved ones or in our home space for longer periods of time than we were used to, and we felt that. There were consequences to that. Having a break from someone and really only interacting, you know, after work, after dinner, that changed to 24-hour interaction. So that's kind of, you know, either on a smaller level or a bigger level or even just different level, that's what happens when you become a full-time caregiver or even a part-time caregiver to someone. You have a relationship with someone. We'll talk about people who aren't related in a second, but Usually the first line caregiver is someone that has a relationship to you. So either their family, their friends, or they're known to you. And suddenly they are responsible or a part of your day-to-day life in a way that's different. And for that to not have an effect or consequences is not realistic. You have a certain way of interacting with people. You have a certain way you relate to people and identify yourself. You have certain things you do and you talk about. And when one person is in a position of need or in a position of assistance, that can really throw people for a loop. How do you balance that change in roles? Hey, I used to be the person you had coffee with. Now I'm the person that you have to call when you need to leave your house because you're unable to leave your house yourself. Or we've been married for 25 plus years and we've had a very active lifestyle, and that was part of what brought us together. And now I'm having to have you help me get dressed, and you're telling me I need to do my home exercises. That's a big shift. That's a balance that has to be learned. That's not something we're innately good at. And unfortunately, that's not a lot of stuff that gets much attention in the process of stroke recovery in the acute phase or in the early phases of recovery, because again, the emphasis is on physical function and getting home. No one's talking about life after home, and once those pieces fall together, okay, we have our discharge plan, we are at home, we have our home equipment, we're trying to settle back into our routines, and we just can't get into it. Why is that happening? And that is 100% related to changes in roles and changes in identities. To think that it's not is a very, small, you're just looking at it from a very small perspective. You have to widen the perspective. That change in roles impacts everything. So let's start hearing the questions and comments about your experience as a caregiver or one who has received care. I think when talking about this, I think it really depends on, I think there's a value to talking to people that are within the medical profession, but also outside of the medical profession. I cannot overstate the value of having a support group. And even if you're not ready to talk, or you feel like you don't have anything to share, or you don't even know where to start, I think being in the same room with someone who is in the same place or further along in their journey is beneficial in itself, because you see that you are not alone. That's the biggest thing. You are not alone. The way that life expectancy trends and healthcare trends are going, we're in a period of time where people are caring for more than one person at the same time. And it can be someone older than you, and it can be someone younger than you. So you have a child, but you're also caring for older parents. Or you're caring for someone younger in your family, and you've got, friends who need assistance. So this time is very unique for us in the sense of being in multiple caregiving roles earlier in our lives and for longer in our lives and for more people in our lives. That's a relatively new situation that we find ourselves in. And so there's not a lot of, stuff out there already to prepare you for that. What's it like to keep your cup full for yourself while everyone else needs you? At what point are you good? Are you good to start living your life? It's complicated, and there are a lot of medical professionals that can support you in that, and at the same time, I think the feedback that I've gotten over the years is that what makes you feel the least alone is having some kind of support group, or at least talking to someone who can relate and has been in those shoes. There's nothing easy about being a caregiver. It is a most often non-paying job. It's an addition to the rest of your life, and it's one that it very quickly uses your reserves, which is why the word burnout is used a lot. And it's not another, when after a stroke there can be safety issues or there can be insight issues, so it's not something where you can just take a break. Like, Some of the suggestions online are kind of a little bit, what's the word? They're not very realistic for the experience of someone in a caregiving role after a stroke. Depending on the stroke, there's a lot of physical assistance needed, often assistance related to the bathroom, so you have to schedule around that. There's safety issues with falls. You have to manage the person's health care needs around your own. So just, as easy as take a break sounds, it's a lot more complicated than that. So sometimes the strategies that are out there can ring a little hollow. So the first step is just really recognizing where you are in your caregiving journey, either receiving care or giving care, and then seeking out resources to support that. I think one of the things that, in addition to the dynamics of having someone be a caregiver, which we'll expand on, there's also something, there are additional challenges with having a caregiver that is not related to you. So for one reason or another, family or friends are not able to provide the level of support at the level that you need, and so you contact an outside agency. So home health, respite care, there are lots of agencies that can provide that help. There are pros and cons, or I shouldn't say pros and cons. People find a benefit and some challenges with going that route. One is additional, obviously, having a stranger in your house. It's additional cost. Sometimes one of the things that people find that it's easier to take direction from or talk to someone who doesn't have that emotional history with you. So some people find that helpful, but it's very, personal care is very personal and intimate, and it can be very difficult, and it should be, that's not a bad thing. That's the reality, to have someone in your home helping you with some of those most personal tasks to you. So there are lots of considerations, and wherever you are, doing the best you can with the resources you have that's the right choice for you at that time. So I think just really taking an inventory of where you are and how being in a caregiver role or being in a role where you need assistance has impacted you. Taking an inventory of that is a very therapeutic exercise in itself. All right, so Marie Leonard says, it's very hard to find caregiver support groups, especially for stroke providers. Do you have recommendations on where or how to find them? So, Marie, are you saying that for medical providers it's hard to find support groups to recommend for caregivers? Or are you asking for support groups for providers of stroke care? I think you're saying the first one. So the American Stroke Association has a support group finder. That's literally what you Google. Kylie will put up a link. American Stroke Association Stroke Support Group Finder. And you enter your zip code, and all your local support groups will come up. And so I have gone through those lists with multiple people, and we've called each and every one to kind of say, hey, this is where I am, this is kind of what I'm looking for, what do you recommend? They're your best resources, because it's facilitated by someone in the healthcare field, so a health educator or a nurse. But the people in that group have had those discussions, right, about where do I get my equipment, or I'm losing my mind, or how do I get a break and I can't afford, to hire help, but I'm doing this 24/7 and I can see it's not sustainable. So that is definitely what I would recommend as a first line kind of strategy. The other thing you can do is go to your provider's office, whether you did outpatient or home health or whatever, and just contact, ask to talk to one of their case managers or social workers, and they should have a resource list for you. And sometimes, stroke survivors and their caregivers, at the end of their journey in the hospital, sometimes give their contact information and volunteer. Like, hey, if someone is having a hard time in the hospital or at home, please let them know I'm here to talk. I'm here to talk and help. So those are some strategies I would ask or those are some strategies I would suggest. And support groups are great, but I have also talked to some participants who, or clients or patients that have said, I'm not the talking type, and so they completely dismiss that, but really use those support groups to support you. So if you're looking for resources, go there for resources. Take what's useful and leave the rest. You don't have to, there's nothing therapeutic about forcing yourself to engage in something that doesn't feel comfortable for you. So go there with an open mind to get the information that you need, and then, excuse yourself from the rest. You're welcome, Marie. All right, I know there are lots of questions out there. Caregiver support is a huge area in healthcare right now, mostly because people are realizing, bottom line for the medical field, they're realizing that not addressing this is not financially savvy. That's how healthcare works. Like, bottom line is money. Caregivers are getting sick. Caregivers are getting burned out. People that they're caregiving for are being readmitted to the hospital because no one is taking care of the caregivers, right? And it's not just, it's not just hard on the caregivers too. It's hard on the person receiving care. I think if I reflect back on my own experiences, I've been the recipient of care more often than I've been in the caregiver role. Times in my life where I was not able to take care of myself the way I needed to. And it's very complicated. In the beginning, you're very, you accept the help and you take the help because that's what needs to happen. But very quickly it becomes a situation of, am I asking too much? Am I becoming a burden? I really don't want someone, I don't want someone's oversight 24/7. Like, I know I need help, but I also, need you to shoo away. So it brings up complicated feelings on both sides. And for sure, when you have a stroke or any other chronic life-changing event, any issue or any challenge that was percolating before in the relationship will be magnified and will come to the forefront after a health-changing event. And so you've got the current situation, then you've got past emotions, and then you've got uncertainty about the future, and then all that combines into this big bubble of how we're going to make this work. It's hard to ask for help. It's hard to accept help. It's hard to do that for a prolonged period of time. It's hard to feel balanced in your life in a caregiving role. And that's true for people who do this for a living as healthcare professionals. And that's also true for people who are thrown into this this caregiver role without any medical training or support. So I think just awareness of how this change in roles and identities has affected you is the first step, awareness, and then figuring out a bigger plan from that. Where are all our questions and comments? I'm just going to keep talking. I'd really like this to be, an interactive question and answer, because I want you to walk away with some information based on what's on your mind, as opposed to this just being a lecture, because I can talk for a long time, but I want this, the live Q&A is meant to be a different format. So the caregiver role, in terms of self-care, some of the things that you may hear about are things like respite care, where there are free services through your social service agencies and things like that to come in for a few hours and give you a break, or they can do some errands for you, grocery shopping or things like that. But just like everything else that we've talked about, it requires a little bit of upfront work. So I highly suggest that if you are in a position as a caregiver right now, or you foresee having to provide caregiving needs in the near future, you have parents who are aging, or you're still taking care of children, or you have close relationships where you are going to be the emergency contact or have to provide help, I highly suggest you be proactive and get your ducks in a row. You know what I mean? Like, here are the respite, and respite just means, break. Here are the respite services in my area. Here is where I can go to get support for medical equipment or groceries or gas money or things like that. Really activate your network. And if you don't have a network, start getting a network. Like I said before, I think last time, it's always easier to learn about fire extinguishers when you're not actually on fire. So get your team together. I recently have started with my brother and sister. I need to do a better job about it, but really getting that information ready for our parents, because we know the level of care is increasing. We know that we all have 3 very different lives, and we want to make sure that we have a plan so that we're fair to each other, and we're also fair to our parents. So those discussions are challenging. But just like you plan for anything else, it pays off to not have to stress about the who, what, when, where, why, and just have to activate the plan. Linda, or let me make sure there's no one before that. Okay, Linda says, I think we're all too exhausted to ask questions. So far, great information. Thank you for going live on caregiver information. You're welcome. Exhausted is the right word. It's exhausting. Talking about it is exhausting. Living through it is exhausting. Doing research on it, advocating for yourself, it's all exhausting. And unfortunately, the requirement to having to advocate for yourself is not going away. Everyone is overbooked, everyone is overworked, there are not enough providers, there are not enough appointments, there's not enough anything. And you really have to be your advocate. You have to know your rights, and you have to go after what you need. The services are out there, but unfortunately it's on us. It's on us to find it. And, the point of the virtual Next Step program, the American Stroke Foundation, and really the online support community is to really bring all that together so that you do have a place to be like, hey, I heard, so-and-so talk about this on such day, where can I get more information? And really using this as a village and a network. So that's our bigger vision for people who cannot access our in-person programs. Allison says, my caregiver right now is my husband for the most part. I cannot drive, so I have to rely on someone else to take me places. I love my hubby, but I don't want to be a burden. It's more of a bother to me than to him. Yeah. That's something that's echoed a lot by people I've worked with over the years, and by other providers. Or anytime you need care, you feel more self-conscious about it than the person who's providing care says that they feel about it. So navigating those feelings is part of the caregiver experience, whether you're on the giving end or the receiving end. And so I think, having those discussions about how you're feeling, or having a time to do a weekly check-in, I think that's a very healthy, adaptive way to kind of approach situations like that, because as much as he'll say, he may say he's not bothered, it doesn't necessarily make you feel any less that you are bothering him, right? And so that means that conversation is needed. And, I always remind people, like, what is a partnership, right? When you decide to spend a good part of your life with someone, it's with hopefully the understanding that, sometimes someone will need more assistance, and sometimes another person will need more support, whether it's emotional, physical, whatever. Not everyone is going to be at their best, feeling their best, being able to give themselves 100% of the time. you know, and that's what a partnership is. That's what a team is. You support each other, you pick up the slack, you balance each other out. And so sometimes people don't, you know, think about that stuff when it comes to bigger health problems, but those are discussions to have too. Like, hey, I'm feeling this way, and I just want to tell you I'm feeling this way. I understand that you're telling me it doesn't make you feel this way, but I'm feeling this way. And I'd like to, you know, first just have space to say that, and second, you know, come up with a strategy. Like, does it make me feel less like a burden if we're going somewhere and we're planning a trip together versus our trips together always being for my health care, you know? Or what is it that I can do to show you? What is it that I can do to help you, that also, because that will also help me. Those conversations are not a bad thing. Those conversations are what healthy couples and teams and partners do to grow together. People change and they don't keep tabs on it, and they don't keep tabs with each other, and then one day it's like, whoa, you're really, you know, annoying me right now. Or this is totally not me and this interaction style isn't working. People say, what happened? It's because people don't do check-ins with each other. To think that individuals don't change and that doesn't affect the spousal relationship, the family relationship, that's unrealistic. So those conversations are a strength. Those conversations are a good thing. Those conversations are not a sign of problems. Those are a sign of wanting to work together as a team. Okay. So Kim says, I'm a home health care aide. I provide, oh, okay. She provides home health care. Thank you for doing that. The virtual Next Step program, Marie. So the Next Step program, so the mission of the American Stroke Foundation is to empower stroke survivors and their families in the challenges after stroke. And the Next Step program is a program that we have in the Kansas City area to really help stroke survivors and their caregivers continue to make progress in their physical, emotional, and cognitive goals. So we have 3 in-person sites, and they work, we have groups facilitated by occupational therapy students and students from other disciplines to help keep your brain and body engaged. So it's a structured environment, it's a group setting, it's not medical, it's a wellness-based site. But it provides a place for you to go with a structure, and most importantly, you're with peers. You're with other people who have had a stroke, you're with caregivers, and so in that environment of peer-supported group participation, people continue to work on their goals outside of the medical model. And so the virtual Next Step program, of which this Facebook Live is part of, is just our way to grow so that people who cannot access our 3 in-person sites can still have access to the information, of a place to go to get more information on their goals. So if you go to our website, americanstroke.org, we have a blog, we have education lectures, we have links to our YouTube, Instagram, and Facebook, and they all have videos or notes or posts that talk about topics that are helpful and have been helpful to stroke survivors. Marie, let me know if that answered your question. Okay. What other questions do we have? Okay, good. I answered Marie's question. Woo! Win. Okay. So we've kind of talked about caregiving with family or friends. We've talked about caregiving from an outside provider. We've talked about kind of the challenges and changes that you can see both as a caregiver and as one receiving care. So what do we, how do we balance that? One of the things that I do with the American Stroke Foundation is facilitate a caregiver support group. And the theme that consistently comes up is, how do I balance who I am? So we have a lot of spouses. Most of the people in the caregiver support group are spouses of people who've had a stroke. And it's, questions like, I don't feel like a wife anymore. I feel like a personal trainer, or I feel like the person that's always nagging them to do exercises or things like that. And the feedback from the other participants is always interesting. Sometimes it's very much of a, well, yeah, I didn't feel like a wife for the first 3 years. We had one mission, and that was to get better. And I was the motivator, I was the encourager, I was the personal trainer. And then we have some with an experience where, that delineation was very important for them, and they realized they couldn't do both, and they weren't comfortable with both. So hiring someone as outside help was non-negotiable, because it was detrimental to their spousal relationship to be the primary caregiver. And I think that's the value of, support groups with people who have been in your shoes, is that you hear the real story, and the real story at the beginning is that it's messy. It's messy, and it's frustrating, and it's scary, and it's overwhelming, because it's hard. You cannot be, it's very hard. At what point do I stop bothering my spouse about their exercises? At what point can we just have a conversation that doesn't involve the stroke or the consequences? At what point can we, just go out but not make it a therapy exercise? Like, get up like this, make sure you get in the car like this, make sure you use your cane. How do you re-engage in life as you know it? How do you re-engage in the interactions as you know it, with this big, not elephant in the room, but the thing that's obviously changed? And that requires time. I don't think there's an easier answer than that, is that it requires time, and it requires years. And I think having those discussions early, before someone has a stroke or before someone has a life-changing health event, is wise. What happens if, I can't take care of myself? What happens if I'm no longer able to drive? What happens if I need help on a daily basis? Those are the conversations that you need when you intend to grow with someone. What other questions do we have? We have, I'm thinking of one couple that comes to the American Stroke Foundation, and they kind of, I don't know how long it took them to kind of get to this point, but they have a much more lighthearted relationship and daily experience after the stroke than they did before the stroke, because they realize that you don't need to worry about the little things when such a big thing can happen. And I imagine it took some time to get to that point, but their dynamic, if you talk to both of them, they would say that the relationship and their quality of life and how they engage with each other is a lot more lighthearted. And that's just them. Everyone has a different experience, but I think the big thing to be mindful of in the beginning is, don't make any drastic changes. Don't do any 180. Don't throw the baby out with the kitchen or bathtub, kitchen water, say babies, whatever they call it. Don't throw the baby out with the bath water. Thank you. It's going to be chaotic. It's going to be messy. Don't make any drastic changes. Get the bandages on where they need to get on. Do what you need to do to get through the day. And then longer term planning is when you're going to have those discussions about, I understand that, you're my caregiver and I need help, but also understand that I was a complete person before this and I still need my alone time, right? One of the things that, so I have students at the American Stroke Foundation, and one of the things I asked one of the students to do is, hey, have you talked to the stroke survivor? Have you talked to her about like what her daily routine looked like before the stroke? Like at what point, what time did she get up? Was she a morning person? What was her morning ritual? When did she start doing stuff with her husband? When did she have time away from her husband? What did she do to kind of regroup? Because that doesn't disappear just because she had a stroke. And then also talking to the husband, what was your routine? And then what was your routine together? And then working within the confines, or working within the framework of what assistance she needs as a stroke survivor to reestablish as much of that normalcy as possible, right? Like, yes, she needs help getting from sitting to standing, but that doesn't take away the time needed to like have a place to go by herself. So how can we set up her place of reprieve where she doesn't need to be standing, sitting, where she can go by herself in her wheelchair and have her time, just like she would if she didn't have a stroke, right? We are whole people. A stroke is not who we are. It's part of it's part of our story. It's a chapter, it's not the whole book. So really, but no one had that conversation with her, what do you need as a person who's, this person, not as this person who's had a stroke. We don't think about those things a lot of times. So really looking at, how to carve out space for yourself, how to reestablish the things that are important to you. Those are things. Once the dust settles and you realize this is going to work, this is not going to work, then you have those conversations. Then you activate your network. Then you have those discussions and make sure that as individuals, as a mother, as a father, as a son, as a daughter, as a friend, as a child, that you are still a whole person. The chances that one of us is not going to need help or that we are not going to be in a caregiver role sometime in our lives is small. And so hopefully the resources that are out there become more user-friendly. They become more accessible. The stigma around it or the shame around having to ask for help, hopefully that goes away as we have these conversations that, hey, caregiving it's not just a side job. It takes up a whole part of your identity, and it needs the support and respect, just like any other job would. Allison says, you are so right. Thank you, Allison. Okay. Questions, comments? Do we have any caregivers on right now? Or is it just our stroke survivors? Allison says, I used to be the caregiver to all my elderly family members, and once I had my stroke, I can no longer do that. Yeah. That actually, is a pretty complex situation in itself, right? You were in a role where a lot of people relied on you, and you had your sense of time and identity related to that, and then you had a stroke, and the needs of those elderly family members doesn't go away. Your needs change, and how do you reconcile that? It's caregiving it deserves more eyes on it from all angles, to keep everyone healthy and to keep quality of life healthy. This North American culture is very different than other cultures when it comes to caregiving and how our families are set up. We're very used to nuclear families and everyone moving out at a certain age and everyone kind of establishing their own homes and family being dispersed. whereas in a lot of cultures, that's not the case. Households are intergenerational. There's an expectation and even an honor associated with taking care of your elders, and so it has a built-in network. It doesn't mean the dynamic is always healthy. It just means that the culture is set up to, in terms of physical proximity, to have natural caregivers nearby. And that's not the case here. But I think we've seen a lot during these last few years of people moving closer to family for that reason, that it doesn't make sense to be providing care or receiving care from a distance, or knowing the power of having people close. I cannot, I think, emphasize that enough, is activating your network. If you cannot activate your network, getting a network, spending that time. You know, we pay a lot of money in taxes, and so our services should serve us. If they don't, that is when we use our voices to advocate for ourselves. Every 4 seconds, someone has a stroke in the United States. That is not a small number. That is something that cannot be addressed by one and done hospital stay. That is something that changes your life forever. And it's not just you. Your family has it too, right? Any life-changing event, it affects everyone. So having the support to make a very comprehensive, person first, family first approach, because those are the long-term healthcare providers. It's family, it's friends, it's not the doctor. Let's see. Alyssa Alcudia is a stroke survivor. Judy says, I am a caregiver. It's challenging. I'm 74 and retired in June. Yeah, right? It used to be that I'm retired, the kids are grown, I'm good. And a lot of times, and I know a lot of our stroke survivors that we see at the American Stroke Foundation are finding themselves in caregiving roles for adult children, or having a second job, if you will, as a caregiver after retirement. And that's very difficult. We all have changes. They're all, stages of how we grow up in our human development. And retirement or ceasing work as a productive pursuit, that is a very emotionally challenging stage in itself. That's a whole discussion on itself. And when what we're expecting or what we've seen in people older than us is different than what the demands are for us, who do you look to, right? Who's your guide? Where's the handbook to that? I've spent all this time with work being my main use of time, my main source of identity, right? What's the first thing people ask? What do you do, right? And now, as opposed to having a break from that and a chance to kind of reconcile where we are in life, that work, that time we used to spend for work gets immediately replaced with caregiving demands. So it's very challenging, and there's not a lot of guidance to navigate because it's a relatively new experience for a lot of us. Carol says, my daughter and I are caregivers for my husband. So Carol, it'd be interesting if you're open to sharing how your experience as a caregiver is different from your daughter. A lot of times people, because it's a different relationship, right? There's different emotional background with being a father versus being a husband. And so that definitely plays into the caregiver dynamic as well. Judy says, my husband had 3 strokes in 2 months, brain injury involved, a long struggle to get him home. I just get through it day by day or hour by hour. One day at a time is sometimes too long. So yes, hour by hour. Do the best you can with what you have. And I wish there was something more meaningful that I could say. That's just the truest thing that I can say is do the best you can with what you can, with what you have. And always know that you are not alone. You just ask the question and hopefully your team will get you to the right person. Alyssa says, strokes are hereditary. I had my diagnosis by a biopsy in 2018. Yes, there are definitely genetic correlates to stroke that may put you at a higher risk. So definitely being an advocate and getting your physical health, getting your baselines, seeing your doctor regularly, and knowing your health history and your risk factors, because lifestyle modification is such a huge part of secondary stroke prevention, if not primary stroke prevention. We can't prevent all of them, but we can stack the odds in our favor. Judy says, thank you for your insight. You're welcome, Judy. So last call for comments or questions. Next week, we will be doing our live Q&A on vision changes after a stroke. So the most important point about vision is that vision is more than just eyesight. It's more than just how well, that vision chart that they give you, how well you can see an object of a certain size at a certain distance. That is the smallest part of vision. And unfortunately, that's the extent to which we take care of our vision. But vision is much more complex. It's how the brain uses the information coming in through your eyes to make the appropriate response. And after a stroke, there are a lot of vision changes that can happen. They can be very disorienting. Not everyone knows how to diagnose them. Not everyone knows how to talk about them. Not everyone knows how to support you after them. And so vision is kind of one of my areas of interest, because it's 90% of how we take in information, and really just sharing information can be so impactful. So it's something that I'm very passionate about, so I'm excited to talk about that. So if you have any concerns or questions or changes, or if you're a provider or if you're a caregiver, please send us your questions in advance or join us, because there's a lot more to vision than meets the eye. Ooh, I made a pun. Okay. Alyssa says neurologist in Philadelphia area. You're a neurologist, Alyssa? Welcome. Okay, last call. Sorry I cut out last time. I ended the video and didn't realize there's like a delay, so it sounded like I just slammed down the phone on you guys, but I didn't. Okay, so again, questions, comments on caregiver support, burnout, anything else, I'm happy to help. Next week is vision. As always, contact us through americanstroke.org. It's our one-stop shop. We are here for you. And I wish everyone an awesome week. Take care.